Guess this thing is on? Everybody hear me okay back there? It's a little loud. Just stay that way? Okay. Well, welcome to the first installment of the Healthy Aging Lecture Series. We're glad that you came out this afternoon. Before we get started, just a couple of announcements, a couple of events going on this week. The first one is the Downtown Farmers Market. It's going to happen this Saturday, which is the 27th. It'll be on 19th and Buddy Holly from 9 a.m. to 3 p.m. It's just a good farmers market, fresh local food they sell out there. The second one, we're having a medication clean out here at the Texas Tech Physicians Pavilion, which is the building just across the way. And that'll be also on Saturday from 10 a.m. to 2 p.m. If you guys have any out-of-date medication, you can bring that up here and they will dispose of it for you. Third, there's going to be a food drive at 3 of the Walmarts here in town this Saturday on Loop 289 in Quaker, 82nd in Milwaukee, and West Loop and 4th Street. It's from Meals on Wheels. They're asking for single-serve, non-perishable, and in-date items. So if you're out and about and have some of those things, or want to go buy some and donate to the Meals on Wheels, they're having that. Our next lecture will be on October 22nd in this same room. And the speaker will be Nathan Burgess. He is an assistant professor in the physical therapy department, and he'll be talking about aging productively. And then one more is on October 21st, the Community Medical School will have their first lecture. It'll be either in this room or in 150, which is just down the hall. And that will be from 5:30 to 6:30, and we'll have President Mitchell and Chancellor Duncan speaking at that. So without further ado, we'll get to the main event. We have with us from the Department of Speech, Language, and Hearing Sciences in the School of Allied Health Sciences, Dr. Amanda Rodriguez and Dr. Stephen Zupancic. Am I saying that correctly? Fantastic. Dr. Rodriguez is a recent graduate with a doctorate, a clinical doctorate of audiology, correct? Fantastic, from Texas Tech. Her undergraduate work was at the University of Texas in Austin, so try not to hold that against her too much. She's still a good person. Oh, we have a Longhorn out here. Excellent. And you did start in May, correct? You started working in May. That's fantastic. And then Dr. Zupancic is an associate professor in the School of Allied Health Sciences in the Department of Speech, Language, and Hearing Sciences, as well as an adjunct assistant professor in the School of Medicine Department of Surgery. He got his undergraduate from Eastern New Mexico University a Bachelor of Science in Communication Disorders, his clinical doctorate of audiology from Texas Tech in 2003, and a Doctor of Philosophy in Communication Disorders, also from Texas Tech in 2007, and he's been working here ever since. So without further ado, Dr. Rodriguez will take it over.
Can you all hear me okay? All right. I'll let you all trickle in the back. Feel free to come in and out as you please. Thank you for joining this afternoon on this almost very sunny day. I'm going to talk about Dr. Zupancic on the audiology's role in assessing older adults' balanced health care. So we're audiologists. We're going to go over basically what happens with normal functioning balance and abnormal functioning balance, and who you can go seeking help from in terms of audiologists and your doctor and things like that. So most of you have probably experienced dizziness at one point in your life, or you will. Dizziness is becoming very common among older adults. And it's so common that it's happening among about 65% of older adults over the age of 60 have reported feeling dizzy at least once or once before their lifetime. More than 300 hospitalizations have occurred due to dizziness-related hip fractures. So dizziness can be one of the number one causes of people falling. And we know that falls can lead to a kind of a downward spiral for an older adult in their health at that point. Dizziness, though, can be very vague. Dizziness can mean different things for different people. And so for the medical side, we classify dizziness in kind of 4 different areas. I'm sorry, 3. So one of them is vertigo, feeling like the room is spinning. Another one is called presyncope, or feeling of lightheadedness, wooziness, I'm going to pass out feeling. And the other one is just equilibrium, so feeling of general imbalance, unstable. But for most of you, you've probably told your doctor, I've been dizzy. And the doctor asks you, well, what does dizziness mean? You say, I don't know, I'm just dizzy. And that's common. It's hard to explain what dizziness is because dizziness can change throughout your lifetime. Dizziness can mean different things. Some of you may say that you feel woozy, you feel like you're spinning, you feel like the room is spinning. All of that is still relevant. All of that can mean something specifically is going on with one part of the body or multiple parts of the body. Dizziness is now often termed multifactorial. So it can actually be caused from multiple systems in the body. For example, dizziness can be related to the ear, an inner ear problem or otologic problem. It can be due to what we call polypharmacy, or interactions between the medications that you're taking, such as blood pressure medications and pain medications. It can be due to neurologic issues, such as early onset even Alzheimer's, dementia, Parkinson's. Or it can be due to anxiety conditions. All of those things now in research are showing can lead to some sort of symptom of dizziness. So as you can imagine, it's hard for you to tell your doctor what dizziness means. It's hard for us to diagnose the problem. So we really need your help to really come to a conclusion together. So one of the first people that you might encounter when you express concerns of dizziness or imbalance is your primary care doctor. And they're usually the first ones to try to kind of see what they can do for you. And they'll try usually kind of a wait-and-see approach. They usually might prescribe you some sort of anti-vertigo medication to help you kind of through the vertigo stages or dizziness stages. And they might wait a little bit, a couple of months, to see how well the body can kind of get over the dizziness on its own. After that point, they might refer you to a neuro-otologist or a general otolaryngologist. These are physicians on the surgical side that are trained to do surgeries of the ear, but also are clinicians trained to treat potential dizziness disorders. However, what we're seeing now in research and literature is that dizziness isn't always inner ear related like we thought it was. And so what we're seeing is that more and more patients are expressing dizziness and imbalance and falls due to other things I talked about: anxiety, orthopedic issues, polypharmacy issues, interactions between medications that you're taking. And so a lot of the disorders that we're seeing that are affecting your balance are not really life-threatening. They don't require surgical intervention. In fact, one of the most common disorders, and I'm going to give you the acronym, BPPV, benign positional proximal vertigo, is the most common balance disorder, and everybody at one point may get it, may not, and if it happens, it's okay. Literally, we have these marbles that sit in our inner ear in a pool of fluid, and for whatever reason, sometimes those marbles get knocked out of place, and they go into the wrong part of the balance system. As audiologists and physical therapists and doctors, we're trained to basically move those marbles back into place by moving the person's head in different positions. So what we're seeing is that a lot of these disorders are very common, affecting more people than we think they are, and actually relatively very easy to treat. Unfortunately, a large population of our patients go throughout their lives with a disorder undiagnosed for many years. And so they're suffering in those time frame, potentially putting a higher risk for a fall. And so this kind of adds to this overall risk for both us on the medical side as well as for you all as patients. What you'll probably see is that as you're waiting for going from your primary care doctor to go to a specialist, it can take a while. Never ever it's very rare to see a specialist in a week time frame, right? You usually have to wait a couple of months and weeks out. What that does is it poses a risk for you during that time for a fall. And so what we always advocate, and things that we are seeing through literature, is that audiologists, physical therapists, primary care doctors, we are trained now to become more aware of dizziness and the multiple causes. We're also trained to come in at an earlier time during your intervention. So we're trying to help at an earlier time before the fall has occurred. And the main part is that falls in population of older adults can be very important. There's a higher increase of falls in this population simply due to just the aging process. Through this time, we're losing sensory cells of our vision, sensory cells on perception of our feet, knowing when our foot's touching the ground. Orthopedic issues come into an important part here. What we're also seeing is a higher incidence of stroke and things like that that can affect overall balance. What we're finding through literature is that patients over the age of 65 will encounter a fall at least once within 12 months. That's a lot. And once that first fall has occurred, multiple falls can happen thereafter just due to overall unsteadiness and not receiving the right kind of therapy intervention that we should thereafter. There's also a slower recovery for falls now, just due to decreased bone density. Those fractures, the hip fractures, the broken bones don't heal as well as they used to in our younger years. And so it's now a higher risk for a fall. And what that also means is a lot of consequences for you in your life, both physically. Physically in terms of you used to be able to go drive your car, go out to the grocery store, take a walk. All of that can lead to a decrease in mobility. And what that causes then is a kind of a psychosocial fear of falling. I see a lot of patients in our clinic that have dizziness, and they have substantially decreased their physical activity, and their daily life has gone down as far as their quality of it. They no longer play with their grandchildren, they no longer go on walks, they no longer want to drive their car. What that does for us mentally is increase our fear of falling. It increases depression, anxiety, all those things that we don't want that will add to decline the quality of life for an older adult. It's also very expensive. With every hospital cost, as you probably know, is tons of dollars being here and there for laboratory workups, imaging, hospital stays. And so what we're trying to do in this presentation is make you aware of different avenues and options that are available to you if you're concerned about your dizziness, concerned about general imbalance. So I will now turn it over to Dr. Stupienczak, who will go over kind of the general anatomy, physiology of what a normal system looks like and what an abnormal system looks like.
Ma'am,
Yes.
in all this distance, you didn't mention anything about blood pressure.
Dr. Stupienczak is going to go into that further.
Oh.
So that's a good point. We talked about kind of this interaction between medications. One of the indications that blood pressure can be altered with multiple medications being taken at the same time. So blood pressure can in fact be a cause of the dizziness and more of the lightheaded wooziness feeling. But he'll go into that further in our disorders section.
Okay, can everybody hear me okay? Too soft? Need louder? We'll go all the way up there. Is that still too soft? Or is that getting okay? That's okay? All right. Okay. So what I want to do is just support a little bit what Dr. Rodriguez was just saying, and the dizziness aspect of what a person may feel when they say they're dizzy has a lot of anatomical and physiological differences that can cause a person to feel dizzy. So a lot of the dizziness that occurs is a problem with the inner ear. Okay? That's going to be where there's a majority of what we term vertigo. That's where it's going to, the source of the problem is the inner ear. And so it's this part here. Right here, this is the cochlea. This is the hearing organ. Okay? And right here we have all these canals. We have the anterior canal, the horizontal canal, the posterior canal. All those help us know what direction we're moving. And then here, this is responsible for telling us, are we walking forward, are we walking backwards, are we going up and down in an elevator? So our ears have really great ability to give us the information of our location in space. Okay? Without that, if we didn't have our inner ears to help us, we basically would be without awareness of our environment. Okay? If you were outside in the dark in the backyard, no lights, no visual cues, you didn't have your inner ears, you wouldn't have any idea where you were. Okay? So our inner ears give us the idea of this is where I am and this is where I need to be so I don't stumble, so I don't have that just general unsteady feeling. So it gives us a little bit of a clue as to where our body is in space. Okay, so the primary role of the vestibular system is going to be that our ability to maintain contact with our surroundings in a safe and efficient manner. And to back up just a little bit, whenever I say vestibular system, I'm talking about the visual system. So we have our eyes, our somatosensory system, which is our sensation of touch, and then we have our inner ear. So those three basic components are what typically constitutes our balance system. And disruption of any of those systems can cause us to feel just unsteady in general. So if we have an infection that disturbs one or both of our ears, then our balance feels a little bit off. Or if we have a condition, like diabetics have peripheral neuropathy a lot of times, loose sensation in the bottoms of the feet or the hands. Unsteadiness happens that way also because people can't feel where they're walking. So a transition from grass to a sidewalk can sometimes be very disconcerting because they can't really feel those adjustments, or they can't make those adjustments on the fly. So the whole idea, the whole need of our vestibular system is so that we can live our lives in a safe way in any types of environments. Walking up and down stairs, walking across sand, any of those kinds of environments without a vestibular system would be very difficult. So whenever we have a problem with the vestibular system, there's many, many causes that can result in a disturbance. One of the most common ones is going to be just an infection. There's a disorder called labyrinthitis. So basically, this labyrinth of canals that we're working with, their infection gets into there, okay? Or it affects the nerve that allows it to work. So if an infection gets into that system, the efficiency or the function of that system will not be as good as it was. It may still have a little bit of function, but it's going to be decreased from where it was previously. So if we have an imbalance between our two ears, we're going to feel like we're always spinning. Okay? So most of you, or at least the majority of you, have probably had one episode in their life of true vertigo, where you actually feel like you or the room is actually spinning. Okay? And most of the time, that is related to an imbalance in your ears. In younger individuals or individuals who are active, an imbalance can be compensated for with your brain. So the key is, if this imbalance does happen, you feel vertigo, our natural reaction is to stay still, don't do anything. But what really helps us is to teach our brain how to adapt to this imbalance and keep moving. Because if we never give the brain the appropriate input, the brain will never learn how to help itself. Another really common cause or source of dizziness in general is trauma. Like Dr. Rodriguez brought up a little bit ago, those crystals in the ear that sometimes come loose and cause problems. If you hit your head, whether it be because of a fall, or you're in a car accident, or any type of injury to your head, those crystals can be knocked loose. All those crystals are doing, or all those crystals have, they're right here in this little area. They just sit in a very fine gel matrix. It just kind of holds those crystals in. Now sometimes if we hit our head hard enough, those crystals can come loose and just start floating around where they're not supposed to be. Okay? So this part of the ear that has the crystals responds to gravity. So that's how we know if we're standing up, laying down, moving forward or backwards, because these crystals are pulling in some direction in relation to gravity. This part here, these canals, they don't respond to gravity, they only respond to movement. So when those crystals come out of the gravity area and get into the canals where they're not supposed to be, People get really, really dizzy when they lay down, they sit up, or roll over in bed, because those crystals are now causing a problem in an area because they're not supposed to be there. So like she had mentioned, our main purpose for that one is we just put the crystals out of those canals and put them back where they're supposed to be by just a series of head motions and some diagnostic testing that we do. But trauma, that's the most common result of trauma that we see, is just those crystals being knocked loose. There's a host of other things that can happen because of trauma. It all just depends on the type of trauma that a person experienced. But the BPPV one that was mentioned, that is the most common source of dizziness following head trauma. Metabolic issues, there is, just related to the general body function, can alter the person's just general feeling of steadiness. So they're diabetics, all those, if the blood sugar gets a little too low or too high, people may feel off balance, okay? Another one, like the gentleman mentioned earlier, blood pressure. If the blood pressure gets too low, people can have these kind of pre-syncope type of episodes where you're sitting down or laying down, and then all of a sudden you stand up, and the world kind of almost goes black a little bit, okay? And then if you stand there long enough, everything comes back and you can do your business. But it's because the blood pressure is too low sometimes after a person sits. Because whenever you sit down, blood is going to pool in the lowest part. Gravity is going to pull it down. So it's a heart's responsibility once you stand up to get that blood back up to your brain. Okay? If the blood pressure isn't sufficient, it doesn't have the pressure to get up to your brain fast enough. So that's why you get a little bit of lightheadedness. Now the problem really happens, because I get that, everybody gets that to some extent if you get up too fast, if you've been laying down or sitting down for a long time. It becomes a problem if a person actually does pass out or faint, or it extends past just 1 or 2 seconds. Okay? Most of you know now that you need to take some extra time. If you're sitting down or laying down, you stand up, you don't do anything for about 30 seconds and everything's good, then you start working. Then you start to move. And that's a good strategy to prevent you from falling. Because the worst thing that you can do is get up, feel lightheaded, start moving, and the next thing that's going to happen, you're going to fall and you're going to hurt something. You're going to break a hip, you're going to hit your head on something, which causes a whole host of other issues. So the main issue with that one is just take it easy, take it slow, don't rush if you have that kind of sensation. Congenital. Some people are just born with abnormal systems. Okay? Whether it be something that happened during the development process or medication that the mom was given, there's some congenital issue that happened during development. When that person is a child, even young adult, it doesn't affect them because the brain is sufficient. The brain can accommodate or compensate for any differences. Okay? But as a person gets older, the brain doesn't compensate as well. So that person may be have a higher likelihood of having imbalance. So that's just something not very common, but it is something out there that we do see occasionally. We have one little kid in the clinic right now. She was born without anything in her related to her hearing or balance. So this whole system right here is just gone. She was born without it. But she's able to walk, she's able to run, she's able to do everything because of her age, and that's how she was born. So the brain can do amazing things if it happens early enough. But later on, she might have difficulty simply because of the brain's lack of ability to compensate for those types of problems. Okay, so as people age, everybody is going to have poor balance as you get older. That's just one of those things we just have to know and be okay with. It's just going to happen. The main reason this happens is because there's a loss of general sensory cells that happen. And I apologize for keep going back and forth, but In each of these canals and each of the spaces in the labyrinth, there are sensory cells. There's billions of them whenever you're born. As you age, the number of these sensory cells declines as a person gets older. So as it declines, the responsiveness of the system to different types of movements gets worse as you age. And so what that results in, so if you're walking forward, you don't have as good of sensation of how fast you're going. You don't have as good a sensation of what direction your head's in. So there's just overall generalized poor balance. And some of you may have witnessed that whenever you try to do the heel-to-toe walk. So, at first, whenever a young adult, it's a relatively easy thing to do is to walk heel-to-toe. And watch me just walk off this one. You can walk heel-to-toe while maintaining your balance. As you age and lose some of those sensory cells, which happens, it's not a disorder to lose those, we just know it's going to happen. Balance can get worse, okay? Because you're not able to recognize small movements. So when you're doing this, I know that I'm swaying a little bit, so my, my muscles and everything can do that to compensate for slight variations. So it never gets to the point where I have to reach out and touch something. But if you have fewer sensory cells, what happens? It takes a larger movement for your body to realize that you're getting off center. So, and it's easy to compensate if you catch it easy. So you just go a little bit to the side, a little left, right, that's easy to compensate for. But if you start getting too far over, that's when you have to reach, because you don't actually realize that you're tilting until it's too late, and then you have to actually reach out for something. If there's nothing to reach out for, that's when a person falls. Okay? As long as you can have something to hold on to, most everybody is okay. And I bet you there's at least a couple people in the audience here who are what we consider to be wall walkers. So the people know that as they age, they like to have their hand on a wall. Or they always like to have their hand on something, whether it be a cane or a wall, not for support, but just for that extra input to help compensate for that loss of sensory cells. So we see patients all the time who are walking in the hall, their entire side of their body has to be on the wall, otherwise they feel unsteady. So they just run up and down the wall just with their shoulder there so that they're able to maintain balance. So the key is that this is normal, but we need to figure out how there's a certain point where it becomes abnormal. Okay, some imbalance, some just general unsteadiness is going to happen, but we need to be able to figure out how much imbalance is present so we can figure out what we need to do for you. Because the last thing we want to happen is for you to fall. Like Dr. Rodriguez mentioned, with a fall, we run risk of breaking hips, hitting your head, and then quality of life and duration of life decreases if there is a significant medical injury that happens as a result of the fall. So we like to catch them early before it gets to that point. So other issues that a person may feel, if that loss of sensory cells doesn't happen equally, a person may feel vertigo. Okay, they may feel that true spinning. And with that, people may be fine just sitting there watching the television. But as soon as they try to start driving, trying to merge onto the loop or look left and right to make sure if you're across the highway, you move your head fast, you get a little bit dizzy. Your head just doesn't feel right. That could be because of an asymmetrical loss of sensory cells, or it may have been because of an infection that happened 30 years ago. Okay, and now your brain just can't compensate for that. So we need to figure out which one it is so we can help give you the tools to make yourself stronger, to make yourself so your brain can compensate and feel better about what this new input is. So like I said, risk of falling due to loss of balance, that's our main concern. The other thing that's also really, really important is that there is a psychological effect that a person has just by being dizzy. I can't tell you how many patients have come in because they feel embarrassed that they think their friends or people around them think that they're drunk. Because they walk, they kind of stumble around all the time. That's their main concern because they can't walk in a straight line anymore. So that tells us, one, that person needs help because they should be able to walk in a relatively straight line. But if they're stumbling that much that other people are noticing, that person needs help. We need to be able to see them in order to figure out why are they feel like they have to stumble and what is causing that and what can we do to help them. And a lot of times, something simply as just using compensatory strategies can help a lot. I mentioned the cane. A lot of people have perfectly strong legs. They're able to walk, no problem. There's no physical limitations for walking. But just by having a cane in the hand and be able to just lightly touch the floor helps compensate for that loss of sensory cells to make them feel a little bit more steady. Okay? So if there's just something, not any pressure on the cane, but just having a light touch on there can help a lot of people. Using walls, using handrails, making sure everything is well lit. All those kind of strategies can make people safer while they navigate their environment. So, common causes of vestibular dysfunction. We've talked about BPPV quite a bit. Okay, that's like she mentioned, this is going to be the most common cause of dizziness that we see. Because it just happens. You know, those crystals come loose. It's a great system, but it is a system that is designed that these things are going to come out eventually. So with that, that's our most common. Vestibular neuritis, that's when you get an infection of one or both of your ears. Again, very, very common. And you know, that's one of the first things we look for just because of the prevalence is so high. Then labyrinthitis, very similar issue with that. Head trauma. If a person does hit their head, if it doesn't cause BPPV, it can cause other things. If a person has a skull fracture and it actually damages some part of the inner ear, then a person might feel dizzy after that. Or if they have actual physical damage to the brain, there can be issues with that as well. Ototoxicity. Ototoxicity and vestibular toxicity is medications that are toxic to the ear. So certain medications like antibiotics, some of the really, really strong antibiotics, can actually damage the hearing or the vestibular system. Now, with this, you kind of take this balance. These medications are typically only given if it's a life or death situation. So we either get rid of this infection, you lose your balance, or the infection gets the best of you. Okay, so it's better to lose your vestibular system than it is your life. Okay, so ototoxicity does happen, but we do also have strategies to help the patient if they have to be on one of those medications. Polypharmacy. This is kind of the up-and-coming thing in terms of treating or working with balanced patients, is that there's so many patients that are on multiple medications prescribed by multiple physicians that a lot of times the interaction of all those medications is not a good thing. We've seen patients who are on 2 or 3 different blood pressure medications, and they take them all at the same time. So their blood pressure was incredibly low just because they've taken so many medications. Other issues, if you look at the insert for a lot of your medications, dizziness is one of the main side effects. But if you take a bunch of those for the same issue, then all the interactions between those medications can cause a person to feel more unsteady. So this kind of polypharmacy idea is something that you really should bring up with your physician, your primary care physician, and why it's incredibly important that whenever you go see your physician, that you take a full list of every medication you're on, including any type of supplements. Because there's a lot of supplements out there that people, get from Walmart or Walgreens. They're not prescriptions, so people don't really think about them. But they do have some physiologic effects. And sometimes those interactions of the supplements and prescription medications can enhance symptoms of dizziness. So if a person's feeling just always kind of lightheaded off, it wouldn't hurt just to tell the physician, the primary care physician, this is what I'm on, especially if they're prescribed by multiple physicians, just make sure everything is okay. Okay? Or have a discussion with the pharmacist wherever you fill your prescription, just to do medication review, just to make sure everything's okay. All right? The last one, neurologic disorder. Neurologic disorder is can be congenital, it can be developed, where just the general nervous system is gradually declining in how well it's working. MS, CP, all those kinds of neurologic disorders can result in a decrease in balance function. So fortunately, it doesn't happen that often where we see really overt dizziness because of neurologic issues, but it is something to watch out for. One that is a neurologic condition that is coming more and more commonplace is the idea of migraines. Migraines and dizziness, there is becoming a greater correlation between those two. People who have been diagnosed with migraine headaches, but they can also have dizziness associated with those migraines. So a person with migraines is at potentially a higher likelihood of having dizziness episodes, or always feeling kind of lightheadedness just based on the effects of that migraine. Okay, so whenever we see a dizzy patient, the first thing we do is spend a lot of time just talking about dizziness. Like we mentioned initially, the whole idea is that we need to figure out what you mean for dizziness. What does dizzy mean to you? And a lot of times people say, well, I just feel dizzy, I just feel off. Well, that helps me none, okay? Because that is just, it's such a generic term. So what we have to know is, do you feel like you're spinning? Do you feel like you're lightheaded? Do you feel only dizzy whenever you are turning your head fast or bending over? So we spend a lot of time really kind of nitpicking all the situations that you find yourself getting dizzy. And this helps us develop a plan of what tests we need to do in order to really identify the cause of your problem. Now, if a person says, I just feel dizzy, I feel lightheaded whenever I stand up from sitting, the first thing I'm going to do is we're going to take your blood pressure when you're sitting for 5 minutes, and we're going to have you stand up, and then we're going to take it again. And if that is a positive test, then we say, okay, let's go talk to your cardiologist or your primary care physician and see what they can do about your blood pressure. Okay? If your blood pressure falls too much. If a person says, I only get dizzy whenever I turn my head real fast, then we're going to do some of the other tests I'm going to talk about here in just a second. But we're going to do really in-depth questioning of what in the world you're telling us as far as dizzy. Okay? So that's the main thing, and that's the focus of the test. Most of the time, we have in our head an idea of what's going on before we do any test, if we did a case history good enough. Okay? So we're able to really identify what's happening to you. And a medication review is in there as well. In our team, we have a pharmacist or pharmacy that we work with, and we'll send a list and history to the pharmacist. They'll review it all and then make recommendations specifically for your case of what can be prescribed differently potentially, or this person should not be taking 3 different blood pressure medications at one time. Okay. The next thing we'll do is just kind of a physical exam. We do something very similar to what you had in the screening back over there. And that's just designed to give us, again, a general idea of your function. We want to see how, when you're walking down the hall, how do you function? That's our main concern, is we want to keep you safe while you're walking. So we want to evaluate that to get an idea of your how well you stand, how well you walk, and all that. These are just different bedside assessments that we do. We move your head around quickly in order to see, is it one direction or the other direction? We have you do some different movements with your eyes closed, marching, so we can see if you're turning one direction or another, walking straight, and so we do a lot of different things. And then this last one, the Dix-Hallpike, is the one test we use to diagnose BPPV, where the crystals come loose. So we do a series of these kind of pre-assessments just to make sure that we can rule out any of the easy stuff first, and then we get into the harder surgeries. So what also you can have, if you see a physician first, you can probably be referred for MRI, CT, just to make sure everything structurally is okay. There's no abnormalities there. When you're referred to audiology, someone like me, we're going to test your hearing. The hearing gives us a lot of information as to what the balance system is doing. Because as you saw in that first picture, the hearing and balance system are joined together. Okay, they're one unit. So if there's a problem with one, there's likely a problem with the other. So we want to test the hearing to get a good idea of what that is. Then we can do just different types of electrophysiologic assessments that tell us the neural integrity of the ear so that we're able to see if one's stronger than the other. The next one is going to be the V&G, or video nystagmography. This allows us to look at your eye movements. Now people always, the first question they ask, like, why are you looking at my eyes when I think of my ears are the problem? Well, we all know as we're moving our head, our eyes go, eye movements are dictated by our ears. So we move our head to the right, our eyes go to the left. We move our head to the left, our eyes go to the right. If we look down, our eyes go up. Okay? So our eyes are always moving in opposite direction of what the head is doing. So the ear and the eyes have a direct connection to let us know what the status of the ear is. And that's why people seem like they're spinning whenever they have vertigo. That's because the eyes are twitching. They're moving. And that's why you feel like you're rotating. And that's all dictated by what the inner ears are doing. So this allows us to look at the eyes. There's a camera in here that we can look on our screens, and we can actually look at the eye movements to see what are the eyes doing, and then we can evaluate if there's an abnormal eye movement or if there's a normal eye movement. Okay, so we're able to identify what kind of movements are happening. The next test we can do, the rotary chair, it's kind of dark on here, but basically what it is, it's a chair that you sit in. We close you in this booth. It's light, tight. You can't see anything. But we spin it around. Okay? We spin it to the left, we spin it to the right. And we're basically seeing what happens whenever we spin you. What inputs are your ears giving your eyes again? Okay? In a very controlled fashion. We're able to really identify, is this side stronger than this side? If there is, why did that happen? We're able to kind of define what's going on with each ear individually in the rotary chair, which is it's a kind of intimidating looking system whenever you go into the room, but it gives us a lot of really, really valuable information to help us identify what exactly is going on. So management for this, ideally there is, your brain is going to be the best manager for most of this. A lot of people are on vestibular suppressants, things like meclizine, Anavert, all those kind of things are very, very commonly prescribed. They're great for the acute cases. Say you wake up in the morning, you feel terrible, okay? The room's spinning, the world's spinning. They're good for those cases, but they shouldn't be taken for long term. We've had people take them for years, but they should only be taken for like 2 weeks, okay? And then let your brain take care of the rest of it. So that is an acute way of managing with medication to help with the vertigo. Vestibular rehab, just exercises that are prescribed to you to help you or force you to move your head when you don't really want to. Because if you have a disorder, you move your head, it makes you feel dizzy, so you don't move your head. So it's our job to make you move your head so that you feel dizzy, but it helps your brain figure out how to deal with this dizziness, and it ultimately makes you feel better in the long run. So people usually hate us for this, but it's a kind of a necessary evil. Or the cannular free positioning. Cannulas are those little rocks or the crystals in your ear. We can move those to a place where they need to be. Surgical intervention, in really, really, really rare and bad cases, a surgeon can go there and actually cut the nerve that goes through the ear. Really rare, not common. but it is an option for those really severe cases that aren't helped with therapy or medication. So this is a list of everybody that's involved with these management of dizzy patients. It's a long list because dizziness is so multifactorial. There's so many professionals and so many systems that can cause a person to get dizzy. So it's a long list, and it's really no way around it. So yes, it is a concern. Dizziness and falling is a concern. In the next 17 seconds, there's going to be some adult that's going to be seen in the ER due to a fall and the subsequent injuries related to the fall. So it is a valid concern that we're trying to ultimately minimize or prevent because of the significant cost to the healthcare, to your quality of life, and all that. And now dizziness is affecting young adults as well. With young adults are getting prescribed more and more medications. And there's a lot of other stuff going on. So we're seeing it in the younger population now also. Other ways you can do it, there's active. Stay active is the biggest thing. You can use Tai Chi, just general aerobics, walking, gardening. Anything that makes you be active is a great thing. So if you're active, you're helping yourself, but do it in a safe manner. But as long as you're doing it something safely and keeping your head moving, keeping your body moving, that is going to be a great help to you. Medication reviews, remove home hazards. Carpets that are getting old and they kind of bunch up, those are dangerous. Use well-lit walkways, put night lights down your hall, assistive devices. And a big one also is to remove any anxiety. If a person who gets dizzy, they feel real anxious, they feel scared about the next event. And if they're scared about the next event, then it's going to get even worse. Okay, so you have to approach it in a very calm and kind of reasonable manner so that you can start feeling better. And that is it. Any questions for either of us? Hard to see it. No, not even. There's so many medications out there and so many side effects that we'd have to look it up and really analyze it. That would be a discussion to have with whoever prescribed it and potentially your pharmacist as well. That would be a good discussion to have. So I thought, yes, sir.
Yes, on the sensory receptors, you say they diminish. Is there any way to enhance or improve the sensory receptors?
No, it's one of those things that happens. Like everybody's going to get a hearing loss at some point in their life. It's just one of those things that happens. And so he asked, is there any way to improve or minimize the loss of these sensory cells? Not really. But the brain is able to compensate for it if a person remains active. So the more active a person is, the better the brain can deal with the gradual loss of these cells.
I was glad to see you mention the Tai Chi. South Plains Association of Government SPAG has sponsored a Tai Chi program, Moving for Better Balance, evidence-based, 60% reduction in falls.
Absolutely.
Those that participate in the program.
Yeah, absolutely. Yeah, Tai Chi and any of those kind of non-impact aerobics are absolutely wonderful for just keeping people active. Yes, sir.
There's another term called fuzziness. What's the difference between fuzziness and the
Fuzziness?
fuzzy?
They just kind of feel like fuzzy in the head, kind of lightheaded. That's more related to just a lightheadedness. When people say they just feel fuzzy in the head, a lot of times that can be either due to medication, blood pressure, or just lightheaded, just sensation in general. So that's another one of those terms that people come in with all sorts of different ways of describing dizziness, but we have to really figure out what does fuzziness mean. And a lot of times, well, that's what I don't know. So it depends on the person. One person can describe fuzziness as, I feel like I'm about to pass out. The other person could say fuzziness just feels, I can't concentrate very well. So there's a different, we have to figure out exactly what fuzziness means to that person. And so it's such a generic term that there's no diagnosis for fuzziness. It's one of those we have to really weed out and see what exactly they mean by fuzzy. I saw someone over here.
Well, RKC too is even used on its own, so what will I expect that to do with whatever's?
Well, just because the vertebrae fuse doesn't necessarily mean that you're going to have dizziness. What you're going to have potentially is just a lack of compensation because you don't have a lot of active head movement. And that's something else. I mean, staying mobile, staying active would help minimize that kind of activity to whatever limitations you can, without hurting yourself. Sure. Yes, sir. Back.
What is Tai Chi?
Tai Chi is just and I don't know a good definition. Do you know a good definition of Tai Chi?
Tai Chi, there are different types of Tai Chis, but basically Tai Chi is an old martial art that presently today they're used for movement. It's like slow swimming, but the main thing is the shifting of the weight and the sensory correction that you make all the time.
Yeah, so it's a form of we have martial arts where they do a lot of slow movements. It's not impact, but the whole idea is that you're able to move. You shift your weight to different areas, and you're always moving your body, and that helps with the compensation. Helps keep people active.
That's Larry from the UMCA Center. Okay. Yoga Pilates. Hi, Larry. It's Larry.
Hi, Larry. I'm trying to be incognito.
Yes, sir.
It's a bit tangential, but you and many others recommend all of us to exercise more, and one of the best things is walking. The problem with walking in Lubbock is the loose dogs. Do you have any anti-dog thing, besides spray, because we have wind here and it blows back on you?
A big stick is the only other thing.
PetSmart carries a spray.
That's a tough one. What were you saying, sir?
PetSmart carries a spray. That's not a red pepper, but it'll repel the dogs.
Yeah. He said PetSmart sells a different type of spray that repels dogs. That is a tough one, and there are different places, like different gyms and stuff that have walking tracks that are isolated. But yeah, that is a very tough thing, and that's a good question for animal control. Yes, ma'am.
I've been in aerobics class with Robin Walker for 8 years over at the YWCA. And I think that is really a good exercise. She puts us through our movements and everything.
So aerobics at the YWCA? Yes. Anything that, again, keeps your head moving, keeps you active, is going to be the most beneficial for anybody. And like I think Larry back there, all his programs are extremely beneficial for keeping people active, and that's the main thing. Now, if you have a disorder, there's specific activities we give you, but if it's just general aging, just keeping active is going to be the majority of what you need to do. That's good. Yes, sir.
On the blood pressure, I read that for older people, the blood pressure should be higher than your normal blood pressure, keep them from getting dizzy and all that kind of stuff.
Yeah.
I mean, you can read all kinds of crap.
Yeah, Google is the worst physician ever. Because if people search and go to WebMD and all that stuff, they find all sorts of really, really bad information. But that may or may not be correct. I'm not a cardiologist, so I don't want to talk to that. But the problem is whenever the blood pressure is too low because of medications, that's when it becomes a problem for dizziness. So that's where we start to see our issues, is whenever the blood pressure is actually lower than it should be. High blood pressure causes a whole host of other issues. That dizziness is usually the last to worry. But the low blood pressure is where we start having our concerns. Yes, sir.
Could you explain Hawthorne Fuchsby exercise?
Yeah, those are basically vestibular rehab exercises that are given to a patient that may or may not have a diagnosed disorder, but they're at-home exercises that a person can do on their own. So if we see a patient that has no objective signs of dizziness, nothing actually that we can identify as a problem, we may provide those exercises as a way to help you compensate. So it's a very popular one because they're easy to do, they're safe to do at home, but it's one of those that is provided for either that or maintenance. So you had a problem at one point, and then you're feeling okay, but you're still a little bit not right. A therapist might give you those exercises to help kind of keep you going. Yeah, so it's basically a lot of head motions, a lot of movement. Again, just keeping your head moving, keeping your body moving, and to help with the compensation. Yeah. Yes, ma'am.
How is it possible for a person to walk straight and have no problems, but get behind the wheel of a car and they move?
It's head movement. Because when you're walking straight, you don't have to do anything. All you have to do is say, I need to get to that door and I'm fine. But with driving a car, you're this way, you're looking at the radio, you're looking at the speedometer, you're looking up and down. It's the amount of eye movement and head movement you have to do that kind of throws your system off a little bit. So when you look to the left, when you're merging, the whole car's going to go that way. And you look to the right, everything's going to go this way. And so it's a nasty cycle when people start going back and forth. They look at the radio, who knows what direction they're going to go, because they just go everywhere. So it's because of the amount of resources you're having to use cognitively that diminish what the brain is able to handle. Okay, because there's so many other things that go on while a person's driving. Anything else? Well, I appreciate all of you coming to listen to us. I hope you learned something. If you want our card or anything, I have cards up here if you want to get one. If you want to call our clinic or any of that kind of stuff. So I'd be happy to talk with you more.